We're really excited to work together on this new commission from Dulwich Picture Gallery, where we get to create a new interactive artwork for children's services at Tessa Jowell Health Centre.
The piece is called Bubble Dreams, and it combines interactive digital video with kind of traditional mural painting, and the idea is the video brings the mural to life. What families will experience when they come into the waiting room is that they're part of it, that they can see themselves in it. There's various different kind of configurations and scenes, and they'll see that it's all held together by this fantastical bubble machine.
We've worked together with the local community to hear different people's stories, to create a collective artwork. The commissions here are very exciting because they're putting that vision into action, the idea that everybody has their story to tell.
Working with the local community has been really great because I think we started with quite an imaginative idea, but it was really wonderful to test that out and sort of specifically informed by what people need and what they're looking for when they go to a health center. In one of the workshops we watched, the great facilitator had bubbles, and we just watched, like, every age was excited about that. It was just like, as soon as you see bubbles, it's like, ah, bubbles. And it just felt like a really great way to, like, move us to a magical location or escape to other worlds.
We also learnt, in a more general sense, how to simplify, how to be playful, to let things kind of shape themselves in a more instinctive way rather than trying to impose a conventional narrative. And what was beautiful here was the way that the research, rather than leading to complexity, led to simplicity.
Complex simplicity.
Complex simplicity, yes.
When I was flapping like a bird, I thought it might be fun if it wasn't just birds, it was also butterflies. I felt really happy that the idea had been used because they're always colourful and there's always different patterns.
We've been able to have direct conversation with local communities about what their needs are, and some of that's been quite imaginative and a desire for escapism, and some of it's been quite practical in terms of please just give an environment that eases anxiety. Those two things feel quite universal, no matter age or geography or cultural background. That was quite a unanimous response. And the gallery's been so helpful with sort of guiding us in terms of connecting with the gallery collection. We sort of went on a bit of a treasure hunt ourselves, just going, okay, which images? And then having this revelation of, what if some of these objects, like a boat or a windmill or a cow, created this bubble machine, so it was made up of these elements from the collection.
For many years at the gallery, we've been developing our research into the positive impact of creativity on health, mental health and general well-being. We're putting everything that we've learned into action through these new commissions. These will be experienced by everybody who comes into the centre.
There's a lot of responsibility in creating artwork for a healthcare setting in a pandemic. There's a series of sort of practical things, so a big part of the brief was doing interactivity without physical touch, which actually felt a little tricky at first, but was very liberating and really shaped what the final piece is. I think the way they respond to seeing themselves in these imaginative scenes, it's the key to how we're making the engagement work.
We would often talk about what is it to take people into another world. You know, you don't have to be on your phone, you can look up and out. And then the interactivity as well. We had a day where we really figured out that the people in the waiting room show up in the artwork. And you might be able to wave in the boat to someone else who's in the waiting room. And there's a way to connect with each other, even if we're wearing masks or even if we're feeling panicked about what lies ahead.
With the Health Centre and the gallery working in collaboration, we're able to share our vision of creating healthier and happier communities. It's such an important moment, and it's just the beginning. I can't wait to see what we do next.
I think one of the strengths of this project has been the collaborative relationship with Dulwich Picture Gallery. There's a huge level of support and possibility in artists working in a health context because the building is actually saving lives, and so for us to be part of a conversation is just amazing to have people support that.
A lot of the children who come to see this will have had very kind of restricted lives because of the pandemic. In many ways it can be the children's sort of first engagement with art, and also it might be one of their first engagements with a healthcare setting in person. And so that gives us a kind of big responsibility in a way, but it's also a kind of immense privilege to sort of be doing that.
I think my ambition is that people are excited to come to the health. They're like, oh, I can't wait for my doctor's appointment. and that it's a memorable part of whatever experience they're having at the health centre.